Good morning, Ms. Jones. My name is Jada. I'll be your nurse today.
Good morning.
Good morning. Is there anything I can do to help you this morning?
It's really embarrassing.
It's okay. You can tell me. I'll try to
Well,
see if
you
I can help.
say that, but unless you've experienced it, it's not the same.
I may have experienced it myself. Is it a woman problem?
It is.
Okay.
I hope it's a woman problem. Since I've had this sweet little baby here, when I sneeze or cough or laugh or blink my eyes or get up the bed, I pee a little bit. And I have to wear panty liners all the time, and it's really irritating.
Well, Ms. Jones, that's a fairly common problem, so it's nothing really to be embarrassed about.
Common or not, it's still embarrassing.
Yes, it can, but let's see if we can work through this, okay? How much water do you drink a day?
Well, I drink what I would consider to be a fair amount, maybe 6-7 bottles of water a day.
And how big are the bottles?
Usual 20-ounce bottles of water.
Okay, and how often do you urinate per day?
Oh my goodness, I don't tally it. Maybe 6 times a day. I even get up during the night sometimes because my bladder it feels like I have to go.
Is your urine clear or cloudy?
What does that mean? My urine is urine. It's yellow.
It's yellow. Does it appear to be cloudy any type of way or clear? Does it just bright yellow?
I think it's clear. I don't really know what cloudy means, so I don't believe it's ever been cloudy.
Okay.
Jada is assessing whether Ms. Jones has a urinary tract infections. Some patients never know they have them. Jada will need to do a focused GU assessment.
Do you need to go to the bathroom right now?
I could, because I constantly feel like I need to go, but it's not a sudden urge to go.
Well, before you go, is it okay if I check your bladder?
How are you going to check my bladder?
I'm just going to touch the outside of your stomach to feel your bladder.
I guess that's okay.
All right. If you can lay back for me.
Jada needs for Ms. Jones to have urine in her bladder so that she can palpate it. The bladder should be about the size of a pear when full.
All right. Do you think you can empty your bladder for me?
Now that you've pressed on it, I believe I have to.
Well, let's go to the bathroom. Ms. Jones. When you go to the bathroom, can you please put this on and take off your pants below your waist?
Why do you need me to put that on?
I'd like to check your vagina to see if it's swollen or otherwise discolored, if there's any problems. Thank you, ma'am. Hi, Ms. Jones. I'm going to palpate your lymph nodes. Is that okay?
What are my lymph nodes?
They're part of your lymph system that cleans out your blood and keep your system clean. So these deposit anything that needs to be cleaned up and then it's put back into your lymph system.
And what is palpate?
I'm gonna feel and touch your lymph nodes to see if they're swollen.
Jada is making sure that the lymph nodes are less than 1 centimeter. Lymph nodes larger than 1 centimeter could indicate local or systemic diseases.
Okay.
Does that hurt at all?
That's a little painful, but it's not that bad. It's just awkward.
All right, Ms. Jones, I'm gonna lightly touch your vagina. Is that okay?
Okay. It is very cold.
I'm so sorry that my hands are cold. My apologies.
Jada is assessing the skin color, texture, and turgor. She is also assessing the labia to make sure they are symmetrical. There should be no ecchymosis, excoriation, edema, rash, or lesions. Ulcers may indicate an STI.
Good. Have you ever tried to do Kegel exercise?
Kegel?
Yes.
What is Kegel?
Okay. Kegel exercises are exercises that a female can do in order to strengthen her muscles in her vagina area as well as around her urethra to prevent urine from being able to come out,
What is the urethra?
where your urine comes out. Okay? When you do the Kegel exercises, what I want you to do in order so that you can identify what muscles are the correct muscles is the next time you go to the bathroom, when you start to pee, I want you to stop the urine.
Press the
It
And I
might.
feel like I really have to go to the bathroom. You want me to stop?
I want you to start peeing, and then I want you to stop it. That way you can isolate and find out what those muscles are that you need for the Kegel exercises.
Okay.
Once you realize what those muscles are, I want you to squeeze them. Make sure,
Squeezing.
yes. So I want you to squeeze those muscles together. It will feel like you're tightening that very same area, those muscles that you use to stop your urination.
And then how do I know if it's working?
You'll be able to feel those muscles tighten and loosen. And I want you to try and hold that for 5 seconds.
Okay.
It's going to take a little practice. It is. It's going to be hard at first to do, but with practice, you'll be able to identify those muscles. You should do it when you're laying down at first. Once,
So just lay in my bed.
yes, and squeeze those muscles.
And so when my boyfriend or baby daddy comes in and he asks what I'm doing, I'm just gonna say, "Don't worry, I'm
He won't.
strengthening my vagina muscles."
He won't even know that you're doing it.
Well, it's gonna look pretty odd. I'm just laying in the bed.
You only need to do it for a short amount of time, approximately 5 times every time, 3 to 4 times a day.
That's a job.
It is, but it will get easier the longer you do it, and it will strengthen those muscles so that you're not leaking urine. Because we want to get rid of this problem, correct?
Yes.
So let's work on doing the Kegel exercises, and after a while, it'll get so easy that you can do them when you're walking around, when you're sitting, when you're talking to people.
I hardly doubt I want to do that talking to people.
I've been doing Kegel exercises this entire time.
Good morning, Mr. Reynolds.
How you doing?
I'm doing well. How are you?
Not good.
Not good. What brings you in here today?
Stomach is hurt.
How does it feel?
Bad.
Bad. On a pain scale from 1 to 10, with 10 being the worst you ever
11.
felt. 11?
Yeah.
Show me where it hurts.
Right here.
Can you lay flat on your back for me?
Yeah, I can try. Oh.
Can I pull up your shirt and listen?
Sure good.
Have you had any gas?
Yeah, but it hasn't helped though.
Has it helped? When was your last bowel movement?
Last Saturday.
Well, today's Friday. Is it normal for it to go that long?
No, it's not normal. I usually go every other day.
And what was your last bowel movement like? Was it normal? Was it runny?
I'm really supposed to look at that.
Was it hard?
No. Whatever normal is, that's what it was.
Okay.
I'm hurting.
Okay.
Keely is doing a focused assessment of Joe's abdomen. First, she has to do a visual assessment and make note of any scars, striae, or bruises. If she sees any of these things, she needs to get the history from Joe. After her visual assessment, Keely needs to auscultate before her palpations so she doesn't disturb Joe's bowel sounds. Keely is starting with the right upper quadrant to listen to bowel sounds. She will rotate clockwise and she should hear about 5 to 15 bowel sounds per minute. If she doesn't hear any, then she should listen for about 5 minutes to determine if it's absent. Keely is checking Joe for any abnormalities like masses, rigidity, or tenderness. She is also watching Joe's reactions and assessing for guarding behavior or grimacing. At this point, it appears that Joe is suffering from constipation.
Okay, and what do you normally eat? What's your normal diet?
Well, for breakfast I had 12 eggs, cheese, and I had a
A whole dozen, huh? All right.
build my mouth.
Okay.
Oh.
What else have you had to eat? Or do you eat regularly?
Then I had a a chicken breast for lunch, and I had steak for dinner, and after that I had like beef jerky snacks.
Do you normally eat all of this in a day?
Yeah.
So you have no fiber in your diet, really?
No, I don't. I try to avoid fiber.
Oh, okay. Well, you're going to have fiber because if not, that makes you constipated. So I would suggest maybe some Metamucil with your diet if you're not going to eat any fiber at all.
Metamucil.
Yes, Metamucil will help you from being constipated if you don't have fiber in your diet.
Oh.
Okay?
All right.
So I'm going to see the doctor and speak to him and see what kind of tests he can run. We can try to figure out what's going on.
What do you mean test? Like what could possibly be wrong?
Well, it sounds like to me you may be a little constipated and it feels kind of rigid. So you could possibly just be full of...
Morning, Miss Murray. My name is Lauren. I'm going to be your nurse for today. What's going on with you?
Well, you're not really going to believe this, but I was at a party a few nights ago, and we were drinking and taking shots. And somebody dared me. They said I couldn't swallow a Matchbox truck. And it took about 5 shots of tequila, but I finally got it down, and it's been a couple days. And I don't hear it anymore.
Okay. Have you had any nausea and vomiting?
Not since my hangover, but I've been doing okay since.
Okay. What about any abdominal pain?
No, not really, but I feel like this truck, it needs to come out, and it's gonna rip me apart.
Oh goodness. No, let's hope not. Do you have any tightness in your belly? Feel like it's stuck there? Do you have a foreign body sensation in your throat?
No, I feel it's coming down slowly.
Lauren needs to assess Brooke's abdomen and perineal area. The pressure of the trach and the rectum may cause severe tissue damage, and it must be assessed to determine how emergent the situation is.
Okay, I'm going to pull these covers and then I'm going to lift your gown up.
It is very important in this case for Lauren to be able to hear bowel sounds. Lack of bowel sounds or hyperactive bowel sounds could indicate an obstruction.
Alright, Miss Murray, I'm just going to listen to your belly now. This is a little cold, so bear with me. Okay. Alright, now I'm going to lift your gown and I'm going to feel on your belly. Tell me if you have any tenderness, pain, anything like that. Okay, now I noticed some scars and some striae. Do you have any children?
Yes, I have a
Do
son.
you? How old is he?
He's 5.
He's at that fun age. Okay. Alright, now I'm going to inspect your perineum.
What's a perineum?
It is the skin between the vagina and the anus.
So you mean the tank?
The what?
The tank? The tank, the anus, and the tank, my girly parts.
Well then, yes, that is what I mean. I've never heard that before. Learn something new every day.
Me too.
I bet you learn not to swallow a dump truck.
Yeah, I should have done that.
Oops, wrong one.
Okay, Miss Marie, I'm just going to clean that area a little bit just before the doctor comes in. That way he can get a better look. I've already got some moist gauze, so it's a little cold, okay?
Alright, go ahead.
The perineum should have dry, intact skin. Lauren needs to clean the perineum from clean to dirty toward the anus. Since it is likely there is a trach in the rectum, it is very tender and care needs to be taken to not damage any tissues.
Okay, very good. I'm going to cover you back up.
Alrighty.
Is there anything else you need before I leave?
No, I think that'll be it.
Okay, Dr. Smith should be in a little while. If you need anything, just press that button.
Alright. Do they think they might I have to have surgery?
We're not sure yet. Dr. Smith will be in to talk with you more once he gets in here, okay?
That's just great. You know, my mom always said that drinking and cars don't mix.
Morning, Miss Tobler.
Colin. How are you doing today?
I'm doing pretty good.
Good. I'm Emily. I'm going to be your student nurse today. I'm going to take a look at your mouth, see
Okay.
what's going on in there.
All right. You know what I'm
All
saying?
right. What would you like for me to call you?
You can call me Terry.
Okay. Terry, do you use any tobacco products?
I do.
What form?
I smoke.
About how much do you smoke?
I smoke about a pack a day.
You know that's not good for you.
I know it's not
It
good
causes
for me.
oral and lung cancer, and it's bad for everybody around you too.
Yeah. I do plan on quitting right after the semester. But
That's
the
good.
Stress
That's
of
good.
finals.
It's good.
Can't quit now.
And you remember, you can come back to your doctor, and they can help you quit if you need any help.
I will probably have to do that.
All right. Let me take a look in your mouth real quick. See. Say, stick your tongue out. And say "ah" for me. All right. And
Why does everybody ask me to say ah?
your uvula, which is the little hanging part in the back, whenever you say "ah" on vocalization, it rises and it lets me know that there's no cranial nerve damage.
That is neat.
Yeah.
I never knew.
Yeah.
Everybody always asks you to say ah.
And it's always good to know there's nothing wrong in the nodule.
While Emily is talking to Terry, she is assessing her cheeks for swollen parotid glands that could indicate parotitis. She is also checking her lips for pallor, redness, and intact skin, while assessing her breath. Bad breath can indicate infection, poor oral hygiene, or that the patient loves smelly foods. If Emily doesn't ask the right questions, though, she could be in for a big surprise.
Yep. And do you ever have any thrush or any sores in your mouth?
I have thrush on occasion.
Okay. And do you see your doctor for?
Yeah, I have
That-
some lozenges that I
Okay.
take.
Those are good things.
They are. They
Yep.
clear it up right away.
Yeah. All right. And I'm gonna take a look at your teeth, and we will be done.
Okay, no
All
problem.
right. Thank you. I think those are good.
Oh my goodness. Did she just ask me that? So,
That's it.
oh, okay.
That's it.
In a moment.
Okay.
Cut!
Cut.
Stay.
She's grimacing. She's having a hard time.